And welcome back to Capitol Tonight. Well, since Election Day, we've heard actually very little from Governor-elect Andrew Cuomo about how specifically he plans to tackle the roughly $10 billion deficit that the state is facing next year. Now, Andrew Cuomo has made it clear he's willing to go toe-to-toe with special interests, singling out public employee unions in particular. But we learned today that he's been privately meeting with some top health care union leaders, hoping possibly to get a preemptive deal that would avoid a budget war over Medicaid cuts. Now, joining me now to talk more about Medicaid spending in New York is Bill Slyke. He is the Communications Director for the Healthcare Association of New York State. Bill, thanks for joining me.
Liz, thanks for having me.
And we should say also a former healthcare official in the Pataki administration, so you know of what you speak.
Well, no one knows everything about healthcare, that's for sure.
Well, and Medicaid in particular is rather a thorny and difficult issue. It's also one of the biggest expense in New York, along with education.
Right.
So if you would just tell us briefly, Haney's, what it is and what it does.
Okay, Haney's is a healthcare association. Our members are roughly about 550 hospitals, nursing homes, and home health care organizations. So virtually every hospital in the state, aside from a few, are our members, and we advocate on their behalf in Albany and in Washington.
Okay, so obviously then Medicaid is a big issue for you guys.
Sure.
And there is now this report in the Wall Street Journal that not you guys particularly in this report, but we can get to this in a second, but 1199 SEIU, which is actually the healthcare workers union, and it is a particularly large and actually powerful union, although not that many unionized hospitals upstate, if I'm not mistaken.
That's correct. The proportion is downstate.
Right. So they have been quietly meeting, George Gresham, who's their president, according to the Wall Street Journal, with Andrew Cuomo in hopes of getting some kind of agreement so they don't have to have a massive war. And we should say, you guys know also that in the past, particularly I'm thinking of the Pataki administration, there were massive fights, air wars over Medicaid cuts.
Sure.
So this is specifically talking about scaling back the state's home health care program. What would that entail?
Well, our membership put together a task force to come up with Medicaid service or Medicaid cost reduction ideas. And one of the chief suggestions that we're making is very similar. The personal care home health care populations, upstate and downstate across the state, are not enrolled in managed care. It's a fee-for-service based environment.
Right.
So those costs have been escalating significantly. If you look at the Medicaid system and those areas of care where costs are growing really disproportionately, it's not in nursing homes, it's not in hospitals, it's in home care and personal care services. So clearly those are areas where we have to get some cost control. And what we've done with most of the Medicaid system in the past, again, most of the regular Medicaid enrollees are in Medicaid managed care. We think that enrolling personal care home health care services into managed care will help us control those costs.
Okay, but doesn't most studies show that having a person at home and not necessarily in a hospital or a nursing home is actually beneficial to their health?
Well, it can be, and it can also keep costs down. I mean, readmissions is an issue that's big in healthcare right now. We're going to start getting penalized by the federal government, where if we our members discharge someone and they're readmitted for to the hospital for a condition that's hopefully that's related to their initial diagnosis, the hospitals are going to get dinged in their Medicare reimbursement.
Right.
So we need to avoid all of those scenarios, and home health care, those types of services are certainly a good strategy in doing that. That doesn't mean that they have to be exclusive of cost controls, exclusive of ideas like managed care concepts that should be applied to them, we believe, to bring down those costs, bring down the growth of those costs.
And also, when we're looking at this, we also have to keep in mind the umbrella of federal health care reform, correct, and how it would be impacting Medicaid and the health care system, unless, of course, it's repealed and defunded, as the Republicans who took over the House say that they would like to see.
Right, and we're going to assume nothing when it comes to that. Right now, if you look at the landscape for healthcare providers, the federal reform did a lot of things. It included some incentives, but it included some penalties, but it also included for New York State about $13 billion in cuts to Medicare in 10 years. In the last 2.5 years, New York State, through the Medicaid cuts, has imposed $5.3 billion in reductions. So we're looking at massive across-the-board reductions in Medicaid and Medicare. That's going to have implications for service delivery. And these are the things that really led to our focus on the Medicaid task force to come up with real solutions.
Okay, we should also say shorthand is Medicaid is for the poor and Medicare is for the elderly, correct? That's generally the shorthand? Okay.
Generally, yes.
So the problem here is, and I think that the governor-elect has made it quite clear, that we're facing $10 billion deficit at least, and that some kind of cut is going to be required in health care because, of course, you've only got so much pie, and the biggest slices, as we mentioned, is Medicaid and education. So Dan Sisto, who is the president of your organization, is actually on the transition for Andrew Cuomo, as is George Gresham from 1199, as are a number of other people, Ken Rasky from the Greater New York Hospitals Association.
Sure.
It's kind of like a, no offense, keep your enemies close, your friends close, enemies closer sort of thing, it seems like. I mean, he's trying to bring everybody under this big tent so he can avoid a war?
Perhaps. I'm not sure what his strategy is. I know how we want to exploit the opportunity. For us, our perspective is the solutions to truly controlling the cost of the Medicaid program have been known for a long time. Some of the key issues. What's lacking, what has been lacking, is the political will to execute them.
Well, wait, let me just ask a question. Would that also be cutting down on the menu of services that are available?
That's something that has to be on the table.
Right.
That's something that has to be looked at. But it's managed care for the home care, personal care. We have, it's an astounding fact that most people aren't aware of. 80% of the Medicaid expenditures in New York State are spent on 20% of the Medicaid population. So we have this extraordinarily high-cost population that's driving our spending growth in a large part. So these are individuals who are still on a fee-for-service Medicaid system. We need to get those high-cost folks into the managed care system as well to control those costs. And these are things that have been unpalatable politically for a long time. So, our message to the governor is his message. He's been out saying routinely, we embrace it, is that we have to fundamentally redesign the Medicaid system, and that's what we have to do.
Okay, but the problem is, of course, that it takes three to tango in Albany, and Andrew Cuomo has made it clear that he wants this to happen in some way, and yet the legislature has to go along. And, of course, the Senate Republicans, if they take control of the Senate, will perhaps be amenable, but maybe the Assembly Democrats not so much.
I mean, that remains to be seen, and that is, if you're going to address it from a fundamental redesign standpoint, there are going to be obstacles. Does he have the political muscle? Does he have the political will? Does he have the ability to get it done? That's the question.
Does he?
We hope so. We think so. We like what he's saying. We believe in that message of redesign, and we want to be a full partner in making it happen. And our membership understands that there's going to be sacrifices and impacts that are not going to be good for them, not going to be good for us. But if we're going to get there, if we're going to stop kicking down the road this can, of these costs and just pushing it further and further down and driving, long-term costs up, now's the time. It's a crisis. We have to take advantage of the crisis.
There has also been a suggestion. Now, the people that he seems to be most interested in going to war with are actually the public employee unions. And in addition, maybe the teachers. Now, NYSET did not endorse him. PEF did endorse him. CSEA did not. So we're talking about a sort of mishmash of people. You guys don't have to worry about the endorsement issue, so that's good, although the campaign contributions come from some of your members, do they not?
Oh, yeah, and we have a very robust PAC as well. And, our membership, the downstate hospitals are our members as well. So, the issues relative to 1199 are important to us as well. Now, not everyone in our membership agrees on all those issues, and those are things that we balance.
It's been suggested to me that perhaps he's trying to box out, this would be Andrew Cuomo, trying to box out parts of the labor community. In other words, let's say that he could get an agreement with Hades, with 1199, with Greater New York Hospital Association, et cetera, and Early came out right out of the box with some kind of Medicaid cutting agreement. Then he could use that to go to the teachers and say, well, education.
Potentially, but I think the key to any success, to achieving anything for us, from the Haney's perspective, our members' perspective, is that if it's just going to be another budget that has across-the-board Medicaid reductions, just basically a carpet bombing approach, which we've seen in the last several years. That's something that's not going to work for us, and that's something that we're going to work aggressively to discourage, and we're hoping that we don't see that. So the key to success from our standpoint is is, as much as we can this year on a reform redesign standpoint, go after some of the low-hanging fruit issues that are achievable in year one. But we understand, too, the long-term design issues, redesign issues, are going to have to happen in year 2 and year 3. Last
night on our sister station, New York One, Eliot Spitzer, the former governor, sat down with Errol Lewis, who's my counterpart downstate. And he suggested that actually there was a very aggressive agenda that Andrew Cuomo wants to achieve. But he also said that some of the things that he achieved in his administration, short-lived as it was, actually laid the foundation for Andrew Cuomo to succeed. In terms of Medicaid cuts, though, he didn't get very far.
No, the first year, actually, his first budget, I think there was a significant executive proposal, but it was mitigated substantially, I know, by the legislature.
Right.
And that's something that we certainly fought for.
Right.
There were, I think, initially some efforts that were made at the state health department to reform some of the rate structure. It gets very complex.
Yeah.
But it ended up being just tinkering that did more to just distract the industry than truly reform it. So I think there was, you know, with the loss of that governorship, there was probably a great loss of momentum.
Well, we shall see what happens going forward. It's going to be fascinating. In the meantime, I want to thank you very much, Bill Van Slyke from Haney's, for coming in to talk to us.
Thanks, Liz. Appreciate it.